is a good question. I would say, from feedback at user groups, give yourself plenty of time. Ensure you have the right preparation so that you're not wasting time when you're ready to either collate supporting information or get to the input form. Just be aware generally of what the whole context is that revalidation sits in. And there's so much guidance on that, much of which you can access through prep. There is so much guidance that actually nobody should now be coming to an appraisal meeting or a revalidation meeting underprepared. So prep can help its users save time by steering them continually in the right direction. So revalidation, when it's done properly, follows a very linear journey in terms of entering my own information, entering my scope of work, gathering information on my practice, getting to an input form, etc., having an appraisal meeting. So it saves time because it takes the guesswork out of what revalidation is all about. It saves time, as I mentioned earlier, in terms of taking you through a single front door, and you can go into a number of rooms from that front door from which you will gather the correct and appropriate evidence to submit at appraisal or revalidation time. So again, just going in through a single front door at one sitting could genuinely save a huge amount of time and effort. And the tools provided by our partners, again, we all think the same way. We all are in this to enable clinicians to carry on with their day jobs. So everything we've produced is about adding value, saving time, adding real benefit and authority to the process. So we undertake a lot of appraiser training because the appraiser role is crucial in terms of providing the direction, the guidance through which an appraisal is conducted. So if an appraiser has been appropriately trained, and to my experience there's very few that currently aren't, because there's some very clear guidance on this, the appraiser will ask the appropriate questions, will use the right language, will understand how to spot development needs, will be able to interpret things like 360-degree feedback reports, and will be appropriately qualified to take the right actions to steer that doctor or clinician, nurse, midwife along the right journey to become a better practitioner. That's what it's about. This whole process is about raising the bar. As I alluded to a moment ago, it's about raising the bar for the healthcare profession in general. And I think where we started some years ago with a fair bit of cynicism around how revalidation would work, I think it's generally accepted now that this is about supporting doctors, it's about making doctors even better doctors, it's about providing even safer care for patients, and it's about generally raising the bar. And if we can do that, we save time, we save money, and we provide better patient care. It was always understood that this first 5-year timetable of revalidation would be a great big pilot phase. And I think the sceptics would suggest that actually it would come and go again fairly quickly. What's been found through the 5,000 or so doctors that have already been revalidated is that it hasn't been a huge time burden. It's been a very valuable undertaking in terms of either verifying, validating that the individual is very, very fit to practice, or in some cases spotting some development needs. I think the changes in the future will be more specific changes to the process, and I think they will be led by the specialties. So I think potentially in the future certainly if you're a nurse or a doctor, and then breaking that down into a certain specialty of doctor, whether you be a surgeon or a physician or an anaesthetist, I think perhaps you may be asked for slightly different things to prove that you meet the requirements specifically of your specialty. But I think we've even started to build that into the prep system, and only this week we've had dialogue with the Royal College of Surgeons, who are looking at working with us collaboratively on a piece of work that enables our systems to integrate, to talk to each other. So again, you'll go into prep through a single front door, and that will access even potentially your Royal College portfolio.